Ever wondered how critical first aid knowledge can be in a residential care facility? Well, let's dive into that. First and foremost, every facility must be equipped with a basic first aid kit. This kit should include essentials such as adhesive bandages of various sizes, sterile gauze pads, adhesive tape, triangular and roller bandages, an alcohol-based hand sanitizer, antiseptic wipes and solution, disposable gloves, tweezers, scissors, a thermometer, a CPR breathing barrier, instant cold packs, eye wash solution, an emergency blanket, aspirin, pain relievers, hydrocortisone cream, and a first aid manual. Now imagine there is an accident. The first step is ensuring that the resident or residents are out of immediate danger. Assess if first aid is needed. If the victim is responsive, introduce yourself and offer help. If the victim agrees, proceed with first aid administration. However, if the victim refuses, call 911 and wait for their arrival with the victim. If the person is unresponsive, assume that your help is needed and proceed with first aid or CPR. Protective gear such as gloves, eye protection, and mask protection are essential to protect yourself from threats related to first aid administration. If you come into contact with bodily fluids, blood, or skin, follow these steps. Remove gloves if wearing any. Wash the area with soap and water. If contact is made with eyes, nose, or ears, rinse with water. Wash your hands thoroughly with soap. If not available, use a waterless hand sanitizer and wash your hands with water later. Dry your hands with a paper towel and use a paper towel to close the faucet. Inform your supervisor or the person responsible for emergency response and consult your medical provider as soon as possible. Now let's delve into the topic of burns. Burns are classified into first, second, or third degree, each increment in degree indicating a rise in severity. First-degree burns, being the least severe, impact solely the skin's outer layer. Second-degree burns, a step more severe, affect layers of skin beneath the topmost layer, leading to blisters, acute pain, and redness. Third-degree burns are at the pinnacle of severity, involving all skin layers. When dealing with burns, several important precautions must be noted. Ensure that the burn victim is no longer in contact with the burning material or exposed to smoke or heat. For major burns, call for emergency medical assistance. Avoid immersing large, severe burns in water, as this can trigger shock. Look for signs of circulation. If there's no breathing or sign of circulation, proceed with CPR. If feasible, elevate the burned body part above the level of the heart. Use a cool, moist bandage to cover the burned area. Remember, it's crucial not to apply butter or ointment to the burn, break blisters, use ice, or immerse large, severe burns in cold water. These actions can hinder proper healing, result in an infection, destroy the skin, and even cause shock. Major burns warrant an immediate call for emergency medical assistance. In summary, first aid knowledge is paramount in a residential care facility. From having a well-stocked first aid kit to knowing how to handle burns, every bit of information can prove crucial in an emergency. Remember, the ultimate goal is to ensure the safety and well-being of all residents here at the Family Residential Care Home, TFRCH. After understanding the importance of first aid knowledge, let's delve deeper into the more specific injuries that might occur in a residential care facility. Fractures, sprains, and strains are common injuries that require immediate attention. A fracture is a break in a bone. There are two types of fractures: closed fractures, where the skin remains intact, and open or compound fractures, which involve wounds that may bleed mildly or severely. Sprains and strains, on the other hand, are injuries that occur due to the stretching or tearing of ligaments and muscles, respectively. Symptoms of these injuries can range from mild to severe pain, stiffness, swelling, and/or bruising. While it can be difficult to differentiate between a fracture and a sprain or strain, the first aid treatment for these conditions is generally the same. In cases of uncertainty, it's better to err on the side of caution and assume a potential fracture. If you're present at the scene, send someone to call for help. If the person is unresponsive, not breathing or not moving, start CPR. If there's bleeding, apply pressure to the wound with a sterile bandage or clean cloth. Applying a bag of ice to the injured area can also help. Just make sure to place a towel between the skin and the ice. This should be done for up to 20 minutes. If raising the injured body part doesn't cause more pain to the victim, try to elevate it. In cases where the person feels faint or is breathing in short, rapid breaths, lay them down with the head slightly lower than the trunk, and if possible, elevate the legs. Remember, every second counts when it comes to first aid. Your knowledge and prompt response can make a significant difference in these situations. Heimlich maneuver handling air passage blocks. In this section, we'll be discussing a crucial first aid procedure, the Heimlich maneuver, which is used to assist a person experiencing a blockage of the airway. This is a vital skill to have, especially in residential care facilities where choking hazards may be present. The body relies on oxygen to function, and without it, survival time is limited to just 1 to 3 minutes. Common reasons for air passage blockages can include asthma, allergic reactions, swallowing foreign objects, infections, or injuries to vital organs. For instance, if a person is having an asthma attack, they may experience mild to severe breathing problems. Usually they will have necessary medication available, which should quickly relieve the symptoms. If an allergic reaction occurs, common treatment includes epinephrine, which can be injected through clothing. Always verify the expiration date before administering the medication. In the case of choking, for victims older than 1 year of age, the Heimlich maneuver can be used. This life-saving technique involves giving abdominal thrusts to force air from the lungs, creating an artificial cough to dislodge the foreign object. If the person is sitting or standing, stand behind them and place your fist, thumb side in, just below their rib cage. Grab your fist with your other hand, and while keeping your arms off the person's rib cage, give 4 quick inward and upward thrusts. Repeat until the object is coughed out or emergency personnel arrive. If the person is unconscious or lying down, place the heel of your hand just above their waistline with your other hand on top. Again, give 4 quick upward thrusts, repeating this process until the blockage is cleared or help arrives. Remember, time is of the essence when dealing with a blocked airway. Your quick response and knowledge of the Heimlich maneuver could potentially save a life. First aid for bleeding, cuts, and scrapes. In our next segment, we delve into another common emergency situation in residential care facilities, dealing with bleeding, cuts, and scrapes. In such situations, the first priority is to stop the bleeding. Remember, no need to panic. In most cases, bleeding can be controlled by applying pressure to the wound. Bleeding often looks worse than it is, due to the body's natural reaction to injury. If the bleeding doesn't stop, apply a clean cloth or bandage to the wound and maintain pressure for 15 to 30 minutes. Avoid moving the cloth during this time, as this could re-aggravate the wound and cause bleeding to resume. If the bleeding persists, apply a second dressing and increase the pressure. The second priority is to keep the wound clean, minimizing the risk of infection. If possible, wash the wound with water and soap. If not, and there's visible debris, remove it carefully with your hands or tweezers. Contact emergency services if the bleeding hasn't stopped, or if you suspect an infection or internal injuries, such as fractures or head injuries. For minor wounds and scrapes, a triple antibiotic ointment is generally advised to prevent infections. Here's a quick rundown of the first aid steps. If possible, get the victim to apply pressure on the wound while you prepare protective equipment or attend to other wounds. Stop the bleeding by applying pressure to the wound with a dressing. If unsuccessful, apply a second dressing and increase the pressure on the wound. Contact emergency services unless the wound is minor, or you're confident there's no need for further intervention. Remember, your swift and informed action can make all the difference in a bleeding emergency. As we continue, it's important to note that not all injuries come with visible signs such as bleeding. Non-bleeding wounds can be equally dangerous, if not more so, as the damage is often hidden and hard to assess. This includes potential internal bleeding, tissue, or organ damage. An example could be a seemingly harmless bump on the head that, unbeknownst to us, is causing internal bleeding and poses a serious health risk. Misdiagnosis or delayed response in these situations can have catastrophic consequences. Injuries that may indicate internal damage include, but are not limited to, car accidents, even minor ones. Signs of shock after an injury with no apparent external damage. Injuries from collisions, often seen in sports, especially if followed by loss of consciousness. Abdominal or chest injuries or pain in these areas. Blood discharge after an injury, firearm or knife wounds. When dealing with a suspected non-bleeding injury, here are the steps to follow. Immediately contact emergency services. Lay the victim down flat on their back. Ensure the victim stays still to prevent further injury. Monitor for signs of shock. If the victim becomes unresponsive, start CPR. Remember, in non-bleeding injuries, it's crucial to look beyond the surface. Your astute observation and quick action can save a life. In the next scene, we'll delve into how to handle seizures in a residential care facility. Stay tuned. Handling nosebleeds. Moving forward, our next topic is nosebleeds, a common occurrence in residential care facilities. While often benign and easily managed, it's important to note that in some rare cases, nosebleeds can indicate a more serious, even life-threatening condition due to the rupture of arteries located at the back of the nose. Therefore, it's crucial to know how to handle this situation effectively. Here are the steps to follow if dealing with a common nosebleed. Guide the victim to sit in an upright position. Pinch the victim's nose with your thumb and index finger and hold it for about 10 minutes. This generally applies enough pressure to the septum to stop the bleeding. To prevent reoccurrence, advise the victim to avoid picking or blowing their nose until the bleeding has stopped for a couple of hours, and also to avoid bending. If the bleeding reoccurs, instruct them to blow their nose forcefully to clear out the remaining blood clots. Then repeat the pinching procedure described above. It's recommended for the victim to contact a physician for consultation in this case. However, contact emergency services immediately if the bleeding persists uncontrollably for more than 15 minutes. The bleeding is the result of an injury, as there may be a potential for a broken nose. In the next scene, we will discuss how to deal with head, neck, and spine injury in our residential care facility. Stay tuned.